Welcome back. The world's worst outbreak of the deadly Ebola virus has been taking a toll on West Africa, and those who seem to be suffering the most are the healthcare workers fighting this disease on the ground. Ebola has reportedly killed more than 200 doctors, nurses and other healthcare professionals since June. Caring for Ebola patients is complicated. The patients are highly acute and need constant monitoring from healthcare staff. But to tell us more, we are joined by Jens Pedersen, Médecins Sans Frontières, South Africa's Humanitarian Affairs Advisor. Very good morning to you, Jens. Thank you for joining us.
Thank you for having me. Good morning.
You're back from ground zero, as it were. Just take us back to Monrovia, Liberia, where you've been, and give us the real insight on the situation on the ground, the fear, the panic that must be going on.
Well, the current situation is one where we, unfortunately, as healthcare workers, continue to chase after the curve of the outbreak. We are still struggling to isolate patients in terms of having enough treatment facilities, treatment beds available in order to make sure that we can admit patients and treat them. But we are having challenges when it comes to identifying patients, contact tracing in the communities. We basically need more hands on deck.
Are communities, are they hiding sufferers? Are families hiding members of their family who are suffering from this disease? Is that the case? Does that make it a little bit more difficult?
There are a lot of aspects that makes it more difficult. What we've seen in the past week is that fewer patients are perhaps presenting at the health facilities, but we are very aware that the transmission continues, and we are seeing and we are worried that patients are being cared for at home without caretakers and without patients being given the right protective equipment and the right care, basically.
The World Health Organization makes a lot of statements one sees almost daily. The latest one, there's a warning this week about 10,000 cases a week that they expect in the weeks to come and months to come. What are they doing on the ground? Are they the voice? Are they the ones that are doing the care work on the ground, or is that not the case?
The international response, including from WHO, have been lacking for a long time. Doctors Without Borders already in March termed this outbreak as unprecedented and were criticized heavily by the WHO for being alarmist. Now we're seeing lots of promises being made, we're seeing lots of pledges, numbers, figures, projections. But what we are still missing is for the pledges to come through on the ground and for the support needed for the communities affected by Ebola actually to be implemented.
These infections, are they outstripping the efforts to contain it? And this 10,000 figure per week within 3 weeks, what do you make of that?
Well, the projections are projections. They're based on numbers. From experience, what we've seen in Guinea, for example, is that we have entered a so-called third peak of transmission and of the outbreak. So for the third time, we've had a situation where numbers have decreased only to spike and increase again. And of course, based on that experience, we are very concerned that the same could very well happen in other countries. So we remain adamant that in order to stop the transmission and in order to make sure that the outbreak is controlled, we need to do a lot more.
We see a lot of hysteria around how this disease is being spread. We had yesterday the Center for Communicable Diseases here in South Africa says it's very difficult for this disease, for you to contract this disease. Is that true? Is it so difficult to contract this disease? It seems as if it's spreading rather easily.
Well, it's spreading easily in communities where there is limited infrastructure, for example, in terms of water and sanitation. And with most communicable diseases, such conditions will contribute to quicker transmission. I mean, Ebola is transmitted through body fluids. It's a weak virus in the sense that outside of its host, it doesn't live for long, it doesn't survive for long. So with proper disinfection and hygiene, it's one of the main contributors to controlling an outbreak. But when you see pictures from some of the areas, either the very rural areas in the affected countries or in some of the urban informal settlements, you see conditions where there's very little water, very little sanitation, and of course that's ripe for for any outbreak to spread.
Let's quickly talk about the situation of healthcare workers. We hear threats of healthcare workers wanting to strike access to protective clothing and so forth. Is it really as dire as they say on the ground?
It is. You alluded to the numbers in the beginning, and I think it's important to acknowledge that a lot of healthcare workers, in particular in the affected countries, have taken a massive risk, and they have gone to extreme lengths to try and care for their patients and support their patients without having been given the right tools, and by that I mean training and protective equipment. Now that's something we need to acknowledge, and we need to make sure that the healthcare workers in Guinea, Sierra Leone and Liberia are having the proper tools. So they need more protective equipment, they need more support in terms of nurses and doctors from other countries as well, because they cannot do it alone by themselves. But it is, healthcare workers are at risk.
What are your thoughts on this Texas nurse that was allowed on a plane shortly after treating an Ebola patient? How do you view that?
Well, I'm not familiar with the details of either the protocols of protection and management in Texas. It's very important that we remember you are only contagious with Ebola when you have symptoms.
Yeah.
Which means if you've been in contact with an Ebola patient and you're not actually showing symptoms, the risk of you to spread Ebola to anyone else is very, very limited.
What is needed now mostly? You've said earlier that people need to pledge and everyone needs to get involved, but how are we going to get this disease under control in the short and medium term?
Well, in the short term, we need to fulfill the promises that have been made by various states, international organizations. As Doctors Without Borders, we've issued a fundraising appeal in order to raise more money for our organization to continue the work. We are working with more than 3,000 colleagues in the 3 countries at the moment. We are running 6 Ebola treatment facilities with more than 700 beds. We've had 18 colleagues from South Africa going there, but we need support from the South African public to continue that.
It's a terrible disaster that's affecting these West African countries, but there are always success stories. What are some of the beautiful stories that you can tell? We saw pictures of a boy who came out and celebrated the fact that he wasn't infected. Are these some of the there's the picture that we have of this boy. You know, the look on his face is absolute joy. Are these some of the beautiful moments that sort of the backstory of a tragedy?
It is indeed, and I remember this boy. I was part of the team that cared for him while he was admitted with his father. So this very, very story of this boy and his father was a very, very good story. But also I think what some of the issues or things experienced that touched me the most was that his father came back to the hospital with presents or items that the other patients that were still admitted in the isolation ward needed, cell phones, newspapers, because of course they develop a very unique relationship when you're inside the hospital, being almost cut off from the rest of the world. So we saw a lot of our patients that had recovered from Ebola actually returning to the hospital, and then they would ask us to pass cell phones or clothes or whatever it may be to the friends they've made inside.
Amazing stories. The human spirit will always triumph over adversity. In conclusion, and Jens, what's your message now to South Africans out there watching this? How can they support your Ebola response?
We need the help of South Africans to help the people affected by Ebola in Guinea, Sierra Leone and Liberia. So based on the fundraising appeal, people can SMS JOIN to 41486 and they will donate 15 Rand on a monthly basis. If you want to tailor your donation, you can go to www.decidetodonate.co.za and we appreciate any contribution. We are stretched, but we are continuing to be committed and wanting to help the people of the 3 countries.
Well, Jens, thank you very much for joining us today, firstly, and secondly, for the fantastic work that you guys are doing out in West Africa. Without the response of MSF, I think this would be a much worse humanitarian disaster that we're seeing in right now. So thank you once again. And of course, the message to all of you out there at home is, you've seen on screen where you can make a difference. Please go there and do. It is a disease. It is a humanitarian disaster, not a disease that's playing out in these countries, and it will affect the economies of those countries for years and years to come. There you have it on screen. Support MSF's Ebola response. SMS join to 41486 to donate a monthly sum, 15 Rand. For 15 Rand, you can make a difference and you can make a contribution there to support MSF's Ebola response. You can also go to decide2donate.co.za. There you can put what you can afford. Some of us can afford thousands and thousands of rands. So please do. There's the website where you can go, msf.org.za/Ebola.